I'm here with Dr. H Steinke here in Edmonton, and I'm just wanting to know how long you've been practicing naturopathy.
I've been practicing in Edmonton since 1996. Had a couple different locations on the south side. I've been here for about the last 12 years.
And you were saying that you were the 12th naturopathic doctor here in the province?
When I graduated, I was the 12th naturopathic doctor back in the province, and at the time, most of the practitioners were actually on the older side, so a couple of them passed away, so for a period there was only about 9 or 10 naturopathic doctors in the province. There's currently over 130, I think, actually well over that. So it's a growing profession. They're kind of spread out, sometimes in big cities, sometimes in small towns, but there's definitely been some changes in the last 2 decades.
Oh, so what is one of the #1 changes that has worked to the benefit of naturopathy then?
I think one of the things that really helped us was coming under the Health Professions Act. We had our own act for years, and it was kind of deregulated back in the 80s at some point, and I think without any regulation from the government, it kind of lost some credibility with the public. However, now under the Health Professions Act, it's basically, on par with all the other regulated professions, be it nursing or optometrists or chiropractors.
Interesting. If you had a personal mission, what would you define that as?
Wow. I think in terms of a simple concept, I would probably try and get the average Canadian citizen to really discern between what is health care and what is disease care, because I believe probably here in Canada there's a giant misnomer where we're calling our medical system a healthcare system when in fact it's largely a disease care system, and people get very much confused around what is healthcare versus disease care. So by default, if they don't have a headache or they don't have a skin rash or their bowels are regular, they feel they're healthy. But yet, does that mean that they're not going to fall over from a heart attack in a month? Or does that mean that they can't do 20 push-ups or walk a mile without sitting down? So a lot of people, yes, they're asymptomatic, but how healthy really are they?
Exactly. The traditional Chinese medicine doctors were put to death if the emperor died, so they had to practice health maintenance and disease prevention. Our healthcare system seems backwards or opposite.
I would agree with that. And in fact, even in modern Europe, in many of the countries, doctors are allotted so many patients, and if their patients actually aren't showing up with serious illnesses, they get bonuses for preventative treatments. And in fact, if they are showing up with having a lot of really chronically ill, sick patients, they actually lose part of their salary.
So that motivates them then to be more about health maintenance and prevention of illness.
Absolutely.
That would be wonderful we had that here.
I would agree. And I think there are some groups within our system that aren't that much in favor of that, because there is a lot of money in medicine, and it's not really something that people like to talk about. But your average doctor, your average nurse, they're all very caring people who want to get the best treatments for their patients. However, their education is somewhat limited, and the things that they have access to are somewhat limited. So often if you have a doctor, say from South Africa or someone trained in a different country where they were exposed to more alternative methods, and they try and do them here, they're actually punished for trying to incorporate more alternative, functional, natural methods into their treatments.